Hi, ladies and gentlemen. It's Dr. Julio Novoa, and I'd like you to meet my son, Richard Alexander Novoa. He's almost 4 months old now. I wanted to take a few minutes, and I'm hoping that this message gets out to all of my colleagues from all the different specialties, whether it be psychiatry, rheumatology, and specifically obstetrics and gynecology and immunology. And this message is related to the follow-up care and related to Essure and its complications. What most of my colleagues don't understand or are unaware of is that the Essure permanent sterilization device, prior to being taken off the market by Bayer, had a black box warning on it. And just to take a few minutes, I just want to read off what it says. Warning: some patients implanted with the Essure system for permanent birth control have experienced and are reported adverse events, including perforations of the uterus and/or fallopian tubes, identification of inserts in the abdominal or pelvic cavity, persistent pain, and suspected allergic or hypersensitivity reactions. If the device needs to be removed to address such an adverse event, a surgical procedure will be required. This information should be shared with patients considering sterilization with the Essure system or permanent birth control during discussions of the benefits and risks of the device. So what's important here is that if a patient goes to the primary care doctor, the obstetrician gynecologist, the psychiatrist, and that patient discusses or talks about their concerns related to the Essure device, it is absolutely mandatory, both ethically and professionally, for that doctor to refer that patient for further immunological evaluation by an allergist or specialist in immunology. Why? Because we as obstetricians and gynecologists, which will be the frontline people that take care of our patients, we don't know very much about foreign body reactions. We did not train in that specialty. We don't know very much about it, and therefore we should not and are obligated not to dismiss our patients regarding issues that might be occurring with the Essure device. And more specifically, the FDA is requiring Bayer to do further analysis and study related to the potential issues of the Essure device and both local and systemic foreign body reactions or hypersensitivity. Therefore, our colleagues, my colleagues, should not dismiss patients that have problems that they do not believe are associated with the Essure device. If they believe that the problem is GYN related, of course, that's our specialty, so they should take care of that issue. But if the patient has issues such as rashes, cognitive changes, excessive weight gain, and symptoms that are similar to lupus or other autoimmune diseases, or a worsening of a condition such as hypothyroidism or diabetes, that patient should be referred to the subspecialties that mainly work in those fields, specifically immunology. So it is a professional requirement and in line with what the FDA is requesting in further study, that any doctor that's managing the care of a patient with the Essure coils refer that patient for further evaluation in the subspecialties that study potential issues with foreign body reactions, and most notably, specialists in the field of immunology. So please take this as more than just a suggestion to my colleagues. And why did I include psychiatries? Because as you're aware, patients that suffer from chronic fatigue or chronic pelvic pain, chronic pain syndromes, suffer from depression along with their condition. And this requires a multifactorial management to the care of patients who have Essure devices. It is unprofessional, and frankly, it could be raise issues concerning malpractice. If a GYN doctor dismisses complaints that a patient may have that are seemingly associated with a foreign body reaction, and most often associated with the Essure device. So please, colleagues, please take my advice. Refer your patients that have an Essure device in place that are complaining of systemic reactions, potential systemic hypersensitivity. Please refer them to the subspecialties, most notably the immunologist. Right? Right. Have a nice day, everybody. Bye.